Welcome back to Pristine Smiles. Today we'll be talking about diabetes and oral health. There is strong evidence to suggest that the severity of periodontal disease is influenced by not only the presence or absence of diabetes but also the degree to which it is controlled by the patients. Several oral effects of undetected or poorly controlled diabetes have been identified. This video will talk about how diabetes affects our oral health and what we can do to control it. What is diabetes? Diabetes is basically the presence of too much sugar or glucose in your blood. This high blood glucose can cause damage to many parts of the body such as heart, blood vessels, eyes, kidney, and also your teeth. There are two types of diabetes. Type 1, also known as insulin-dependent diabetes mellitus, is caused due to cell-mediated autoimmune destruction of insulin-producing beta cells of islets of Langerhans in pancreas. In simple words, it means that the pancreas is not able to produce insulin. Insulin is needed to regulate blood sugar level. So less insulin results in increase in the blood sugar level. Type 2 diabetes or non-insulin dependent diabetes mellitus. In this case, the beta cells of pancreas are not destroyed. This can occur because of three reasons. 1. The body develops a resistance to insulin. Now normally insulin uses glucose from the blood for energy. In insulin resistance, body ignores insulin and glucose stays in the blood, increasing blood glucose levels. It can also be caused because of insulin deficiency. That is, not enough insulin is produced to reduce the blood sugar, or there may be an increase in the glucose production in the liver. Now this usually occurs in obese individuals and it can be controlled by diet and medicines. A third category is the gestational diabetes. Now this develops in 2 to 5% pregnancies, but it disappears after delivery. Women with gestational diabetes are at an increased risk of developing type 2 diabetes later in the life. So today we are focusing on oral health. So let's see what all oral issues can arise. So gum issues, like you can have bleeding gums, red, swollen, tender gums. The gums may have been pulled away from the tooth, that is, part of the tooth root is visible, or tooth appears longer, what we call gingival recession. Then other signs include abscess formation, bad breath, change in the bite pattern, mobile teeth or loose teeth, dry mouth, candidal infections, increase in cavities, and poor healing. So how, or rather why does diabetes have an effect on gums and teeth? Periodontal disease or gum disease is considered as the sixth complication of diabetes. Now in diabetes, we know that the blood glucose content is high. So there is increased glucose in the gingival fluid of diabetic patients. Our gums and the tissues supporting the tooth, that is the periodontal ligament and the bone, they are mainly composed of collagen. So when there is chronic hyperglycemia or chronic increase in the blood sugar levels, the synthesis, maturation and maintenance of collagen is affected. Accumulated glycation end products are formed which cross-link with collagen. This new collagen which is formed is less soluble and its repair is affected. Now since this collagen cannot be renewed, it remains in the tissues for a longer period of time. This makes it more susceptible to breakdown. And this results in signs of gum diseases such as bleeding gums or red swollen gums. The plaque may build up and harden under the gums, causing the gums to become inflamed. Infection can spread to bone around the tooth, causing the tooth to become loose and eventually even fall out. Now pain, abscess, loose teeth, all these are seen in the advanced stages of the disease. Gum disease is usually painless initially. So if you see any of these warning signs, please go to a dentist and get yourself checked. Other complications of diabetes may include alterations in the salivary flow. There may be a decrease in the flow of saliva, which can cause a dry mouth. Now, some individuals may sometimes have other medical problems like hypertension, and certain medicines given to treat these conditions can cause dryness of mouth. Now again, as there is less saliva to wash off the bacteria, it leads to cavities. Fungi feed on blood glucose, so candidal infections are common in poorly controlled diabetes cases. High blood sugar level also hinders wound healing. A periodontal pocket is a site of constant bacterial insult. An intact wound healing response is critical to maintain tissue health. High blood glucose levels can affect this healing capacity. How periodontal disease or gum infection influences diabetes? Acute infection, be it bacterial or viral, is known to increase insulin resistance in people without diabetes. This condition remains even for weeks or months after recovery from illness. Such illnesses and increase in insulin resistance aggravates glycemic control in diabetics. Treatment of gum disease reduces periodontal inflammation and may restore insulin sensitivity, resulting in improved metabolic control. How can I keep my teeth and gums healthy? Try to keep your blood glucose levels as close to normal as possible. Brush twice daily using a soft toothbrush. Use a dental floss at least once a day. If you use dentures, keep them clean. Make sure to clean the plaque or food debris underneath the dentures that may irritate the gums. If you have fixed bridges in your mouth, don't forget to clean underneath it. Call your dentist if you notice bleeding gums, soreness from the dentures, or gums pulling away from your teeth. Get your teeth and gums cleaned and checked by your dentist twice a year. Be sure your dentist knows that you have diabetes. So, is there anything special that you need to do before you go for your dental visit? Eat before going to see your dentist. The best time for treatment is when your blood glucose level is on the high side and insulin action is low. Take your normal medications before your dental visit, unless your physician or dentist advises differently. Diabetics do have a higher risk than usual for gum problems. Diabetics with poor blood sugar control may get gum disease more often and more severely than those with a good control of their blood sugar levels. Timely intervention helps prevent the inevitable. Thank you for watching. Please share and subscribe for more dental education videos.